Good afternoon. Welcome to the Master of Public Health Online Programs Practicum Revealed webinar presented by the Keck School of Medicine of USC. I am Kiana Lloyd, and I'll be your host today. First, I'd like to thank you for taking time out of your busy schedule to join us. Before we begin, I'd like to review what you can expect during the presentation. To cut down on background noise, we've muted your phone lines so you can hear us, but we cannot hear you. If you have any questions, please type them into the Q&A box in the lower right-hand corner of your screen and hit send. Feel free to enter your questions as you think of them. We'll answer as many as time allows at the end of the presentation, and a PDF and a recording of today's presentation will be available shortly after the event. Here's a quick look at what we will be covering. First, we will hear from Kelly Arison, an enrollment advisor for the program. She will introduce us to USC, the Keck School of Medicine of USC, and a program overview. Next, we will hear from Keisha Chandler, the Practicum Coordinator, who will take us through the Practicum overview and how to get started. Lastly, I will speak to the admissions requirements and next steps on how to contact an enrollment advisor to begin your application. We will end the presentation with a Q&A session. Now let's get started. Hello, Kelly. Thank you for joining us today.
Hi, Kiana. Thank you so much. And thank you to everyone who has logged in today. To give a little overview, University of Southern California was established in 1880, and we are located in Los Angeles, California. We pride ourselves in being one of the world's leading private research universities. At University of Southern California, we house 17 graduate and professional schools. In addition, there are over 340 master's, certificate, doctoral, and professional degree programs. We are proud to say in 2009 and 2010, USC had 17,000 undergrads and 18,000 graduates and professional students. And from a global perspective, we have more international students than any other U.S. university. And now the world-renowned Keck School of Medicine was established in 1885. It is the oldest medical school in Southern California, located on USC's Health Science campus just east of downtown Los Angeles. The Keck School of Medicine is home to the Keck Medical Center of USC, a state-of-the-art academic medical center comprised of Keck Hospital of USC, formerly USC University Hospital, and the USC Norris Cancer Hospital. The two world-class USC-owned hospitals are staffed by more than 500 physicians who are faculty at the renowned Keck School of Medicine of USC. USC is also partners with the nearby Children's Hospital, Los Angeles. And Keck is home to several research institutes, the Norris Comprehensive Cancer Center, the Zilkha Neurogenic Institute, the Eli and Edith Broad Center for Stem Cell Research and Regenerative Medicine at USC, the Cardiovascular Thoracic Institute, and the Institute for Global Health. This brings us to the need of public health education. The MPH program at USC was established in 1998, while the online version has recently launched in 2013. And the mission of the MPH program at USC is to assist students in creating healthy communities by preparing graduates to lead and collaborate with others in an organized community efforts across a variety of settings, which focus on disease prevention and health promotion among diverse populations. Our core curriculum consists of 47 units, and we have 4 specialized tracks: biostatistics and epidemiology, health education promotion, global health and leadership, and geohealth. This is a little snapshot of the Masters of Public Health program at University of Southern California Keck School of Medicine. Please feel free to reach out to your admissions advisor for more information. We are advocates to assist you and guide you through the admissions and enrollment process. So please give us a call to discuss the program further, as well as your career and educational goals. And now I'd like to introduce Keisha Chandler to review the MPH Practicum portion. Keisha?
Thank you very much, Kelly, for that introduction. I first wanted to say hello to Daniel and Karen and Sandeep because they said hi, so I wanted to say hi to them and welcome all of you to this webinar. I thought I'd give a little bit of background about who I am and how I came to USC. I am an alum of the MPH program, class of 2010, and I was a non-traditional student when I came back to school to get my MPH. I had been out of school for about 10 years, and it had been some time since I had set foot in a classroom of any type, so coming back to school was really exciting, but it was also a little bit daunting, and even more so, understanding the practicum and all of the things that go along with it was a bit intimidating, but I always knew that community-based work was a passion of mine. So my practicum, I chose to work in a local community center here in Los Angeles, and their executive director and their board of this nonprofit community center wanted to engage the baby boomers and the greatest, also known as the greatest generation population, and understand a little bit about what their needs were. And the reason they were interested was they wanted to put a ballot measure on for voting for a bond, which is basically money from the state, to rebuild a community center that matched the needs of the existing community. So what I did was put together all of my public health tools that I had learned during my time in the program, and I did focus groups and town halls and surveys to find out what these incredible resources the people of the community wanted in their community center. And what came up was two things. The first one being fall prevention and also health and wellness opportunities, classes, programs, speakers, and events. So I worked with the executive director and their board to come up with a plan that had materials and classes and that essentially culminated in the launch of the senior program in a big event called Lust for Life, and it was a huge event. There was over 70 vendors that I personally reached out to and asked them to join us. We had over 250 festival attendees. We had a great host who was actually lives in and around the Los Angeles area, which is very special to us because we do have access to really interesting people. And I don't know if you remember the TV show Family Ties, but the dad who played Stephen Keaton, Michael Gross, actually hosted and emceed this festival. So it was a lot of fun. And, I chose this practicum because I was interested in nonprofit work, and I was interested in how to create resources that reflect the needs of a community that's changed over time. So that was my experience in this program, and what brought me to USC in this coordinator position is really a deep love of the field and a deep desire to help students realize their potential through experience-based learning. So next slide, please. So I get this question a lot: what is a practicum, and what does it mean, and what am I supposed to get out of it? And I think that's an excellent question. But I first want to touch on three things that I think are really important to keep in mind. Number one, it is a required part of the curriculum. So as much as you all have busy lives, there really is no way to complete this degree without doing this practicum. The second thing is practicum is actually one part of your culminating experience. I'll talk a little bit later about the capstone course, which is designed to fit and complement your practicum experience. And the third part of the practicum experience is a course called Public Health Leadership and Management. And that is a separate course that outlines the essential role of management and leadership and how that affects your role as a budding public health leader. So to get back to this burning question with what is a practicum, it is an opportunity to introduce the role of public health in a community setting. Some of you may choose an organization or community that already has a strong public health backing, and others, like I did, this particular community center didn't have such a strong understanding of what public health was, and that certainly fall prevention in the senior community is certainly a health issue that's a part of people who are aging, the aging population, a concern. The second thing is that it's important to expand your understanding of how public health is a transdisciplinary field. So there's a wide variety of administrative, policy, and organizational challenges in addressing large-scale public health issues. It also gives you an opportunity to demonstrate the skills and knowledge from your coursework. In addition, you have an opportunity to improve your professional development through on-the-job training. And lastly, it really allows you, should you choose to do so, to assume a leadership role and responsibilities in the public health agency. Next slide, please. So the next natural question is, what kind of work can I do? Essentially, you can do just about any work that you would like to do as long as it's within the field of public health and for a public health agency. But essentially, the type of work that you'll do for your practicum falls into two categories, one being research and program development, and the other being analysis and assessment. The first area that I want to talk in depth about is the research and program development piece. A lot of times you'll be working with an organization who already has a program that they'd like to implement or need you to create one. So that's certainly one aspect of program development that you could do your practicum in. Evaluation of programs, materials, and data. Certainly for the biostatistics and epidemiology track, evaluating data is a large part of what informs what programs and what policies need attention from any organization or leadership. Certainly designing a study or instruments for a program. In my case, I created my own survey using a lot of information and a lot of knowledge that I learned from my program evaluation and research class, as well as my Principles of Epidemiology course. We also highlight there's other areas of program development that's important, which is also editing and drafting funding proposals, or also known as grants. So that is one part of research and program development that is important. The second category is analysis and assessment. So for the health education and promotion and biostatistics tracks, the policy analysis and advocacy strategies are often tracks that are the types of work that you do in a practicum related to those tracks. Needs assessments for populations and or communities, coalition building for cause or resource, really working deeply with stakeholders such as board members and community members and funders and staff within a nonprofit or an agency. Building consensus and building collaboration is a real key part of that, part of the work you can do, as well as pre-testing or evaluation education materials or curriculum. That type of work in pre-testing and evaluation is a big piece of the editing and drafting of funding proposals, because foundations and governments want to fund programs that have proven to work and that have really evidence-based outcomes that can really make an impact on this pressing health issues, both domestically and globally. Next slide, please. So I often ask from individuals, or often hear from individuals, what are the requirements? Essentially, you need to be eligible. You need to be eligible for your practicum, and the way that happens is you have completed all of your core public health core courses and at least one track core course, and you have a GPA of 3.0 and above. You have made contact and have approval with a public health agency who has agreed to take you on as a practicum student. A practicum student is underlined and bolded because you are not an intern. It is often takes some education on the part of your agency and potential supervisor for you to explain to them the difference. And certainly as your coordinator, I can help you craft that language so that they understand that your work as a practicum student is really meant to enhance your study of the field, but also to contribute to their organization. It is a 300-hour practicum, and it requires you to be in the field with a detailed scope of work. So that 300 hours it sounds like a lot. And I'm sure for those of you who work full-time, you're thinking, how on earth am I going to find 300 hours in an already impacted 40-hour or 50 or 60-hour work week? But I can assure you that 30 hours goes by pretty quickly. And there are some creative ways that you and I can work together to make sure you meet that requirement. We require reflective journals every 100 hours of work so that you can engage in the material in your coursework and how it relates to your practicum and relating it back and forth in a really meaningful way so that you're able to see where you're making inroads towards your goals and the challenges that come up, and also how to course correct and reach the goals that you've outlined in your scope of work. We do require that your supervisor, meaning the person who is overseeing your work as a practicum student, has a master's degree or above. It would be great if they had an MPH, but it's not necessary. A master's degree, a PhD, an MD, a JD, any of those abbreviations and letters will be just fine. And also, it's a credit, no credit course, so if you don't complete the hours or the work related to it, you don't get the credit, but that's not going to happen for you. I also often get a couple of questions that I just wanted to throw out because I think it's important to touch on them, is I often hear, can I use my workplace as a site? And the answer is absolutely you can. And we have one student who did a beautiful job of doing that, and the reason why it worked out for her is because she chose a practicum that was listed at her company. The company she worked for is Genentech. And Genentech is really special because they list paid internships for their employees to engage in because they know that their employees are often pursuing other master's degrees or different types of degrees. And so this student used this special list of internships that were listed as her practicum. And the reason why it worked for her to use her workplace as a practicum site is because the work that she was doing was distinct and unique from her day-to-day responsibilities. And she did an amazing project in environmental health. She worked with their internal labs to improve employee safety. She used 2 or 3 really strong health education and promotion theories and principles to implement a stellar training program. And she just actually sent me an email last week that she gave her presentation and her new training program as a presentation to the top brass at Genentech, and they were very impressed. And now her project is actually being replicated and test piloted in other areas of Genentech. And so she really made an impact, and she was one of our, just really a stellar student. And we worked together to make sure that she could do something distinct and really rich as her practicum requirement. Also, you can complete this practicum from anywhere in the world, either domestically or internationally. I know, given that this is an online program, I'm sure there's a lot of folks on this call right now that represent different states and maybe even different countries. It is completely doable. We can certainly talk to you with your enrollment advisor in a little more depth into what that means, and we certainly can make that accommodation. As your coordinator and academic advisor, my job is to make sure that you do create a rich experience but also meet the requirements. I wanted to talk a little bit about a student who's currently doing some work in Ethiopia, and he is working on a really distinct project with an organization called SOS Children's Village, and he's in Ethiopia. He left I think it was March 6th, and he is really working on evidence-based health education and promotion materials for maternal, child, and health practices. And he's working with women and adolescents related to reproductive and sexual health, and is using, the database of the clinic's records to figure out which of those, aspects of disease or prevention, which aspects that he should focus his work on, and is essentially serving as an educator for the lay health workers program that this organization has. He is working with nurses and counselors to educate them on the right cultural language around STI prevention and reproductive health, and he is really excited to present his information at a local university at the end of his practicum time. So he's doing some really interesting work, and he created this practicum all on his own, very motivated. I was really excited to have him leave feeling empowered and excited to contribute to this community and to the country as a whole. Next slide, please. And I noticed the Q&A box is it's not pumping with questions, so please feel free as I'm talking to put in any burning questions that you have. We want to make sure you get the most value out of the time here this afternoon. So often people ask how they get started, and I find that what helps is to take note of the classes and topics that are really interesting to you and that you're passionate about. I want to touch on a couple of points that might help get you thinking in that area of the things that are interesting to you. There are always service learning opportunities, meaning internships or volunteering, that you can begin before you're eligible to begin your practicum. There are wonderful ways to reach out to organizations, and I'm happy to share templates of emails that I've used to reach out to individuals that either are what we call a cold contact, meaning you don't know them, but also contacts that you do know, to let them know that you are potentially transitioning from one career to another, or that you would like to position yourself to learn more about a field that you're already in. It really is about networking. It's about using the things that are available to you coupled with a really poignant strategy to reach out to individuals. We also have special topics courses that are available to you that can expose you to different health issues and systems of health care. One being we do have a special topics course to Panama, and it's a 2-week opportunity to work with the University of South Florida, with whom we have an affiliation with, and we work with them to help get you educated about the Panamanian health system, but we also do some work in the community, and it's more suitable for our health education and promotion track, as well as the global health leadership track. But anyone is welcome to join those special topics courses and learn more about the culture and how that health system works. The second opportunity for a special topics course is the World Health Assembly in Geneva, and they meet for a week in late May. And we take a group of students, a very small group of students and select group of students, to the World Health Assembly to essentially observe governance and policy on a global level. That is a really rich opportunity. We've had so far 3 students participate, one of whom actually got a job interview right there in Geneva. Another opted to finish her practicum at a site after the special topics course ended. She ended up spending, I think, 3 or 4 weeks abroad at an organization that Dr. Ripley helped her secure. So while you may not be able to use these special topics courses for a practicum, it is a nice springboard into an international practicum, which does have a different requirement in terms of time. As I mentioned, the individual spent about 4 weeks abroad, and that's typically how much time we would ask you to be abroad. You know, part of the issue is we want to make sure that you have time to get acclimated, but also that you have time to really do deep work with the individual and organization that you're working with, and to get the most out of your time there. Next slide, please. So as I mentioned at the outset of this talk, the practicum is really one piece of your culminating experience in this program. The essential piece of the practicum is obviously the experience applying your knowledge to a real-world context. However, the capstone course is an essential piece of integrating 3 core areas of public health, the real-world experience from your practicum, as well as the training and education you receive in the program. And so it's really designed to pull those things together. And in that process of integrating, it really helps give you an opportunity to develop a personal and professional identity as a public health practitioner. I'm sure you've all heard the buzzword personal branding. The brand you, and it's never more important than when you are either coming into the job market after being out. Maybe some of you are full-time students. maybe some of you are full-time workers taking classes but preparing to either make a transition from one career to another or to position yourself to leverage this education for the next step in your career. Developing a professional and personal brand and identity as a public health practitioner is an essential piece of making those transitions. And the course is taught in an experiential format with active participation, and live sessions are a part of that. We have some amazing faculty here that I believe do an excellent job at helping you pull that together so that it does feel like a whole experience, and it does feel as though you really are ready to begin your career as a public health practitioner and leader. So that being said, I'm going to turn it back over to my esteemed colleague, Kiana Loy, to talk a bit about admissions requirements. Kiana?
Thank you, Keisha. So now we'll discuss the admissions requirements for the MPH online program. In order to be considered for admissions into the program, you need a bachelor degree from a regionally accredited institution holding a 3.0 GPA or better. You need to submit transcripts from each institution you attended, as well as a GR score of at least 297. That is a combined score of 153 on the verbal reasoning segment and 144 on the quantitative reasoning segment. We also accept a GMAT minimum score of 600 as well as MCAT score of 28. Those can be substituted. You need 3 letters of recommendation. If you have attended an institution within the last 5 years, you will need an academic letter of recommendation. All letters need to be on official letterhead and include a physical signature. If you have not attended an institution in the last 5 years, you are able to use professional letters of recommendation that need to come from a manager or supervisor. You need a personal statement, which is a brief statement describing your reasons for pursuing the Master of Public Health online degree, how this degree will enhance or transition your career, and what you hope to contribute to the field. Lastly, you would need a professional resume or curriculum vitae. Additional materials may be required for international applicants, so it would be best if you contact your enrollment advisor for any additional information. Now it's time for the Q&A session. Please take a few minutes, if you haven't already, and type your questions into the Q&A box in the lower right-hand corner of your screen and hit send. All right, our first question, this question will actually be directed to Keisha. Genentech is an enterprise. I understand that it must be a public health agency. Can you please clarify?
So Genentech does work that is of benefit to the public health, to the field of public health. So, and this student chose a specific role that that I think reflected very clearly some of the principles of health education and promotion. So while it's not technically, a Department of Health or the CDC or some sort of, what's the right word? Like they've declared that they're a public health agency. They are actually doing public health within that agency. And essentially what defined her practicum as being a practicum was her scope of work and the competencies that she chose in order to meet the practicum requirement.
Okay, thank you, Keisha. I actually have an admissions question. We want to know what is the tuition for the program, and I'll hand that to Kelly Arison.
Thank you so much. The tuition for the program is $75,294, which breaks down to $1,602 per credit hour.
Thank you, Kelly. Our next question is very specific. Is there a special topic in molecular epidemiology? Keisha, can you answer that for us?
Sure. Unfortunately, we do not have a special topics course available in molecular epidemiology.
Thank you, Keisha. Our next question is actually geared towards admissions. How large is a cohort group?
The cohort groups range from 25 students to a maximum of 40 students.
Okay, thank you, Kelly. Our next question, suppose I have already experience in public health. Is there a need to do the practicum? Keisha, can you answer that for us?
Like I mentioned before, the practicum is a required part of the degree. There's no way to waive out of doing the practicum. However, it may be an opportunity for you to explore a part of your current career or your current interests so that you can meet the requirement, but there isn't any way to waive out of it. It's 2 units. The program for a whole is 47 units, so without those 2 units, we're not able to grant you a degree.
Thank you, Keisha. I have one more for you. How long does it take to complete the practicum hours while working full-time?
That's a great question. I have worked with students typically about 6 months prior to graduation. So it sometimes can take anywhere from 6 to 9 months to complete it. But the average for our full-time working students is 6 months. Typically, it works out to be about 10 to 15 hours over the course of a 6-month period. So it's 25 weeks. We've had success at people doing that. It does require a little bit more focus, and it requires a little more planning, but that's where I come in as your advisor to really help you put together a customized way to do this that meets your needs.
Okay, thank you, Keisha. Our next question is, what is considered full-time attendance? I'll direct that to Kelly.
Thank you. With regards to full-time attendance, students would be taking 2 classes per semester, 3 semesters per year. So in January, 2 classes, summer semester, 2 classes, and fall, 2 classes.
Thank you, Kelly. One more question for Kelly. Once I apply, how long will it take for an enrollment decision?
I would say typically 3 to 4 weeks upon completion of your application.
Thank you, Kelly. Next question. Will there be help from the program to look for public health agencies that have taken on USC MPH students or may be interested in taking on students? I'll direct that to Keisha Chandler.
Yes, we have a list with over 230 organizations that have taken USC Practicum students in the past. I also get, probably on a weekly basis, at least 4 or 5 requests for Practicum students. They tend to be local requests. However, we do work closely with other organizations that have accepted students in the past, and also connecting students that might be in your region who've completed their practicum. I recently introduced an alumni from our program to a student who is looking to do a practicum at her organization. And so those 2 students were able to actually network and help find a placement. The student helped her find a placement. And it hasn't quite settled. The jello is still a little bit jiggly. We're not sure if she's going to be able to do a practicum there, but we do help introduce you to individuals who have either done a practicum there or who have taken students on in the past.
Okay, Keisha, thank you so much for answering that for us. Our next question is, if I already have a graduate degree, is there an option to waive the GMAT or GRE requirements? I can direct that to Kelly.
That's a great question. We do want to make sure that we are assisting all students in maximizing their time here at USC. That would be something that we would want to review your transcripts, review the degree that you did earn, and that would be something you'd go over with your admissions advisor. But we'd be happy to assist you with that.
Thank you, Kelly. Our next question, what percentage of your students come to the program with an MD, RN, or master's in a life science? Do they have a different set of options for their practicum? And is it easier for them to find a practicum position? If Keisha is able to answer that for us.
I don't have the percentage off the top of my head of students who have advanced degrees. I would say the last statistic I checked, it was about 15%, 15 or 20%. In terms of the practicum options, I do think that as MDs, as clinicians, the types of practicums that you do are a bit more involved and a bit more interesting, and often that's because you are clinicians and sometimes and often leaders in your workplace. So if you have noticed a need or see a need for how the clinical practice and public health can align and create either a program or a study or some kind of data-driven project that can be published. I know for our biostatistics and epidemiology students, getting published is really important, and I do have students whose goal is to publish their findings from their practicum and or present. So I do think that having those professional degrees or clinical training does allow you that possibility, and it's a little easier for you.
Thank you, Keisha. Our next question, do students need to travel for the practicum? Keisha?
Not if you don't want to, but you absolutely can. As I said, you can, if you'd like to use your workplace, it would just need to be distinct and different from your day-to-day responsibilities. Or if you would like to go to Japan to study and work with an organization, you can do that too. I will say that global health leadership is a track that I think, I don't want to say requires you to, but it is definitely in the field, it's important to have had at some point international experience and either participating in global health internationally, leading your own project, or working with another organization. I would say that it's probably strongly recommended that you do so in order to move forward in your career, to make the next career step.
Thank you, Keisha. Our next question is, are you aware if Cedars Sinai is involved in the practicum?
I believe Cedars, not the hospital itself, but departments within Cedars Sinai have accepted students in the past, yes.
Okay, thank you. Our next question is, when does the program begin? I can direct that to Kelly.
Thank you so much. Our summer semester does start on May 6th, and your application would be due April 10th for all students.
All right, thank you, Kelly. Our next question is, if I am currently doing research in a clinical setting, am I able to eventually advance, or will this benefit me in the long run? I can direct that to Keisha.
I think it depends on what your overall career goals are. If you are doing clinical research and interested in public health, and if you'd like to see that research disseminated and potentially influence policy, potentially influence organizational structure or procedures in a larger context, because public health is really a study of health as populations and communities and the world. So if you're interested in taking your skill set to the, national stage or the global stage in terms of the conversation and agenda that is, the agendas that are in chronic disease or environmental health or other areas of public health, then I think it can be beneficial. But it just depends on what your career goals are.
Okay, thank you, Keisha. Our next question is, are all requirements mandatory, or is one weighted more than the others? For example, if I don't have a 3.0 GPA, or if the GRE score was not met but all other areas were, would the candidates still be considered for admissions? I can direct that to Kelly.
That's actually a really great question. We do take a holistic approach with each of our students. So we would look at the full application and talk with each student on an individual basis to be able to showcase your strengths as much as possible. But it is a holistic approach, and I would still encourage you to start the admissions process.
Thank you, Kelly. One other question for you. Are we required to make visits to USC for the online program?
Another great question. You are not required to visit the campus, although you're welcome to come. You are a part of the Trojan family, but it is not required for you to visit the campus through your program.
Thank you, Kelly. Our next question is actually directed to Keisha. Do students ever do a practicum with nonprofit organizations that are focused on a smaller disease population that is not thought of as a traditional public health area?
I can't speak to whether that's actually happened, but I know that working with a nonprofit is absolutely appropriate. It may be that the illness or disease just affects a smaller population of people in terms of the numbers, but if many of the illnesses and issues that are facing public health at one time didn't have a lot of so-called press or buzz, and it through the work of public health practitioners and disseminating that information and research and all of that, it became an issue that we all now know today as a major illness or chronic disease. So the answer to your question is yes, as long as you meet the requirements of the practicum in terms of the supervisor, the number of hours, and certainly that it's a scope of work based on competencies and based on goal-centered work, then absolutely you can.
Thank you, Keisha. Our next question is the accreditation pending, temporary, or conditional? Kelly, can you answer that for us?
Wonderful, yes. We are accredited. The MPH is Council on Education for Public Health, which is CEPH accredited. In addition, we are WASC, Western Association Colleges and Schools.
Thank you, Kelly. Our next question, does the capstone course involve a final paper or project? Can you answer that for us, Keisha?
I sure can. The capstone course does have a paper or project component to it. For tracks like health education and promotion and global health leadership, they do have a project-based paper. For the biostatistics and epidemiology, it is more of a research paper format. So, having a results section and a executive or a summary looking more like a published paper, the format of a published paper in a peer-reviewed journal.
Thank you, Keisha. Our next question, do you accept applications for fall and spring semesters? Kelly, can you answer that for us?
Yes, we are currently accepting applications for our summer as well as fall, and we'll be starting to take applications for our spring semester shortly for 2016.
Thank you, Kelly. Our next question, would there be a formal graduation at the school that we would be able to attend, or is it different because it's an online program? Kelly, can you answer that for us?
Yeah, that's a very exciting question, one we all want our students to be participating in. There is a graduation, the traditional one that takes place at USC, and we invite and welcome all of our students to participate if they choose to.
Wonderful. Thank you, Kelly. Our next question. I am working on a project to create stores in Afghanistan for women to sell feminine products to women because there are little resources for them, which I hope will reduce related infections. Will I be able to use this for my practicum? Keisha, can you answer that for us?
Potentially, yes. Again, your practicum needs to have, you need to have a supervisor with a master's degree or above. You do need to base that practicum on competencies, on the core competencies of your track. But it's definitely a good start, and you may find that your project has one specific issue that we can focus on to build a practicum out of that, and utilize the contacts and data and information to build something that would meet the requirement, but also, do some great work, which it sounds like it's a really wonderful project.
Thank you, Keisha. Our next question is, when do fall classes begin? Kelly, can you answer that for us?
Yes. Fall classes do begin on September 2nd, and your application is due the first week of June.
Thank you, Kelly. Our next question. Since this is an online program, how will the lectures be presented? Are they going to be at a certain time, or are they going to be in podcast or WebEx format? Kelly, can you answer that for us?
Yes, we do have our own system. It's called Moodle, where our classes take place. There are some live lectures. However, if you are unable to attend, they are recorded for a later viewing, but you are not required to log on. It's not mandatory for those classes.
Okay, thank you, Kelly. Our next question, are there any additional specific examples of what other students have done in their practicum? Keisha, can you answer that for us?
Sure. We had one young woman who lives in Miami, Florida, work with the Department of Health in her area. We've had one student last in the fall work for the American Cancer Society, creating some short webisodes that are kind of like PSAs, but doing some storyboarding for those webisodes to air on their YouTube channel. She was a health education promotion student, so she really was wanting to focus on the communication piece and the social media aspect of health education promotion, since that's such an essential piece of our everyday lives, but really is an essential piece of public health. Those are the two that stand out to me. To be honest with you, our first graduating class was in the fall, and it was a smaller class, but this term we've got 27 students that are completing their practicum, so we certainly will have more information about what they're doing once they complete. Our first commencement ceremony for our online students is May 14th. So we've got folks going through the program, but this is our first group of students that have completed and actually have a practicum to speak of.
Wonderful. Thank you, Keisha. Our next question, do you have a payment plan available for tuition fees? I can direct that to Kelly.
There are options for students who are serious about going back to school, and I would highly recommend talking with your admissions representative to share with you some examples of that, as well as give you the contact information for student finance. We do want to make sure we're setting you up for success and giving you all the information necessary to make a good decision for yourself.
Thank you, Kelly. Our next question, Can we do coursework in multiple tracks or add courses from a second track? For example, the epidemiology courses in chronic disease is less important for my field, whereas the additional courses in global health research design would be helpful. Would you like to answer that, Kelly?
Absolutely. We are excited and love that you would like to have more education through USC, but you are more than welcome to, once you complete your degree, add on additional tracks as you see fit. It's wonderful.
Thank you. Our next question, will my diploma say USC online? Kelly, can you answer that for us?
Nope, it will say University of Southern California, Keck School of Medicine, with your degree. No online.
Wonderful. Thank you, Kelly. Our next question, have you seen a successful transition for students who have an undergrad in business administration to an MPH program? Keisha, would you like to answer that for us?
Sure. I haven't seen specifically a BA. I kind of meet our students where they are, which is in this program, so I wouldn't know what their background was in terms of their previous education. But a bachelor's degree in business administration coupled with an MPH, I think, is a really great combination. Understanding business and the way that business is done is essential, because while public health, we are helping people to live better lives, it's still important to understand the economics of healthcare, to understand budgets, and certainly having exposure to accounting and statistics and all of the things that you have been exposed to during your undergrad education, I think would be a tremendous help to you in furthering your career. And again, I don't know what your ultimate goal is in terms of your life's work and your career, but I think the two go together quite nicely, and I think you'll find that your business administration degree helps you more in the work world, and as you grow into a leadership position, and as you become a manager, become a senior level C-suite type of person, I think you'll find that education helps tremendously.
Thank you, Keisha. We'll take one more question. That is, are students able to interact during class lectures with professors or with other students? If so, how does this happen, and are online students usually able to meet with professors? Kelly, can you answer that question for us?
Absolutely. Students are encouraged to interact with other students during the lectures, whether you attend a live lecture, in addition to interaction with discussion questions and assignments. You are an online student, so it's encouraged that you do network and reach out to other students to get best practices and share thoughts and ideas. With regards to meeting with professors, again, this is your education for you to own. If you're in the Los Angeles area and would like to meet with one of your professors, please reach out to them during class and see if you can set up a meeting. You're always welcome to chat, call, email. There's many means for you to be successful and reach out to your professors as an online student.
Thank you, Kelly. If we did not get to your questions, I do apologize. However, your enrollment advisor will reach out to you by the end of the week. I'd like to thank Kelly and Keisha for taking time out to be here today. Remember, if you have any questions or think that it's time to apply, please contact your enrollment advisor. Their contact information is on your screen now. There will be a PDF and a recording of this event, and we'll be sending them out within the next week. This concludes today's webinar. Thank you again, and have a great day.